Satish Gupta ji. Dr. Satish Gupta, he is the Director of Cardiology and Medicine, JWM Global Hospital Research Center, Mount Abu. He did MBBS from Maulana Azad Medical College, Delhi, and MD from the Lady Harding Medical College. He is the MD, PhD, DNB guide. He is a visiting professor of medicine and cardiology in Semey State Medical University, Kazakhstan. And he has awarded so many awards, okay, but I just narrate the few. One of the Lifetime Achievement Award for the outstanding contribution in the field of preventive cardiology by His Excellency President of India, Dr. APJ Abdul Kalam in 2006 at Rashtrapati Bhavan. Next, he was again awarded by the India's President, Excellency Smith Pratibha Patil ji for excellence in cardiology on 22nd September 2008
Pathology
at Rashtrapati Bhavan.
In Rashtrapati
He
Bhavan.
also awarded for the Award of Excellence.
He has been awarded with Award of Excellence, Cardio Rehabilitation in 2011. He is also awarded with Excellence in Medicine in 21st Century by United Nations Organization in 2005.
But the most famous, he is the principal investigator and coordinator of the landmark research study in the coronary artery disease regression, so the three-dimensional health and happiness program.
So he has been in 3D dimensional health program also.
The science and spirituality with the scientific proof and data, and with the live proof. We have the two Dilwalas. Dilwalas means we said that not heart patient. Heart patients are known as the Dilwala here. So Dilwala, after this session, they will narrate their experience about how they open their coronary blockage by this adopting the healthy lifestyle. So over to Dr. Satish Gupta.
Etc. So now listen from Dr. Satish Gupta.
Respected chairpersons and my dear colleagues. आप सोचते होंगे मैं प्रिवेंटिव कार्डियोलॉजी में कैसे आ गया.
You must be thinking how I came in preventive cardiology. I have completed from Delhi cardiology, and after that
in one of the premier heart issues when
I was working for heart issues, I used to see
heart disease,
patients who had heart disease, who come with the heart attack. I used to manage them.
next day we used to, in those days 94, 95,
In 1994,
after
and the next stage it was angiography.
we used to see that they have a block.
We used to see the blockage of the patient and put the stent.
We will come back with another MI,
And after that, when patient come with another MI,
angiogram and find
we
out
repeat the angiography if a stent is blocked.
but other vessels have got blocked.
So stent doesn't get blocked, but the other vessels get blocked.
Angioplasty, repeat angioplasty,
So we do repeat angioplasty
bypass surgery.
through the bypass surgery.
He used to tell me that last time, because the disease had started coming in early
The disease has started coming in
60s and
early 60s or 70s.
from rich people,
Yeah.
this class of the society.
So normally it is affect the high class society, and in 1990s diseases started coming at early age of the people at the age of 30, at the age of 40, and then later on it started at the age of 30.
The talk used to be, the decision used to be the disease is coming only.
So then later on it has been observed that the disease started coming at early age, at the age of 30, and before that also. So those cases also has been discussed in our different meetings, conferences.
The patient used to tell the last time we had to sell our house, now what should I sell now?
So patient usually said that we have last time we had sold our house and gone through the surgery treatment. Now what should I sell? So this has motivated me, and I had a lot of interest in psychology. So I used to psychology many patient, And in those days, during 94, 95,
Circulation, American College of Cardiology, and other.
in the circulation of cardiology,
Many studies were there.
in American psychology, so we have seen in many studies.
Type A behavior.
So the people who had type A behavior,
Time, pressure of time.
who used to under time pressure of who used to be under pressure of time work, so typical type A behavior, who find faults in other sensitive type of behavior and hostile type of behavior, it is very dangerous behavior.
The prevalence of heart disease can be 3 to 4 times more than
So the privilege of the heart disease usually occur they are very prone to this heart disease 3 to 4 times more.
people with depression had
People with depression had 3 to 5 times more chances to get into heart attack. Those mind get into stress easily, anxiety. They have much more number of heart attacks. They are very prone to these heart attacks. So similarly, so lots of research has been done on this. After seeing those things, I had developed a topic, stress and heart disease. In Delhi Medical Association, we used to talk about this. One of the meeting on 6th March 1995, I have spoken about this in IMA meeting, Indian Medical Association, and one of the scientists from DRDO, he heard this talk and he shared it with Dr. Kalam. 9th March, I had a meeting with Dr. Kalam. When I shared this with Dr. Kalam, and he said that, Dr. Gupta, if you do this research, because I was expecting doing research on RAJYOGA meditation, and that time I came in the contact of Brahma Kumaris,
my wife was
and my wife was sitting behind me on the scooter, and my son, he was 8 9 months old. He was in front of my scooter,
in South Extension.
and we saw Brahma Kumari's ashram, which is, it was written Gateway to Heaven. So my wife said that, she said that, see, it is written here Gateway to Heaven, you are taking me to Gateway to Hell. So we were going to watch a movie, cinema. So they said that we don't want to go to see a movie, we should go into Gateway to Heaven, that Brahma Kumari's ashram. Since that day, we went there, and still now we belong to this organization. So when this research program has been completed, we have collaborated with Maulana Azad and GB Pant Hospital and this Medical College Ahmedabad. So we have collaborated with many medical colleges, and we created designed a program and submitted that. And for doing that, on 15th April, I shifted to Mount Abu with my family. Can you imagine? 9th March, we met to Dr. Kalam. Project submitted. 15th April, I wind up everything and left Delhi and shifted to Mount Abu. I was born in Delhi, brought up in Delhi, did my studies, education, everything there. And within a 1.5 month, like, I had a dedication that I have to get engage myself in this spirituality.
After coming here, we started.
Then after coming here, one-to-one counseling, teaching, etc.
27 December 97 को
On 27 December, this program has been launched.
उसके बाद
After that,
फरवरी 98 में प्रोग्राम शुरू
in February 98, we have started this program.
क्या फेस कर रहा हूँ ये हमारा
So I want to share those days what things I have faced.
सेंटर बना
We have a Global Hospital Trauma Center in Shantivan Abu Road. In Mount Abu, we have Global Hospital Research Center. I would like to share my detail. If you see,
अभी आप देखेंगे ये एक
if
पेशेंट
you see, we have a patient from Rohtak.
I'm informing you that this is 2015 survey,
In 2015 survey in major four cities,
and 2015
number of Indian patients with CAD was 62 million,
6.2 crore.
6.2 crore documented heart disease.
कहते हैं for every patient there is at least one patient, one or two patients.
For every patient, there is at least one or two patient who were unknown to me, who come suddenly.
लगभग 15 करोड़ लोगों को भारत में हार्ट की बीमारी
So approx 15 CR people had heart disease.
million before the age of
Out of 2 million, 60%
50 years. That means
below the age of 50 year,
of
more than 60% patient had CAD. This
here 29 lakh people had died because of
29 lakh people had been died due to heart stroke. Out of 15 lakhs, below the age was 50 years.
disease of old.
So it is not a disease of old people,
Disease
more of young and middle aged group.
and just share with you some of the cases.
So
Recently अभी हमारे पास आए
recently I'm sharing some cases.
diabetic smoker
So we have some CAD who were suffering from CAD. They have hypertension, diabetes, sedentary lifestyle.
नया ब्लॉक हुआ
So in 2010, coronary blocked, and then gone through a bypass surgery. And after 3 or 4 months, again the patient suffered symptoms, came TMT positive, and this patient went to US and angiography. He had gone through the angiography. So angioplasty done, and later on, after 4 months, that person suffered with heart attack, and the patient came to me. It is 2014, and from that day to till now, the patient is now absolutely okay when he came to us. So you can see this is a graph. Angioplasty and bypass not ultimate. There is another patient. This person is for 47 years old from Haryana, Jind. This person is having does not have hypertension. Weight is 65 kg, 6.7 cm. So 167. This person belongs to RSS association. This person gone through angioplasty 2013, 2 stent already done, and bypass already done. After 3 months, this person again occurred the problem, suffering. And since then, he is coming to us regularly, and since 10 years, he is very much okay. In India, there is people had diffuse disease. LAD is so much blocked.
पूरा एलसीएस बंद है
LCs is blocked, branches is blocked, RCA is blocked. All the arteries has been blocked. There is no place for going through a bypass surgery. 100% out of 40% patient usually. In comparison to West, we have people who are suffering from this CAD.
ये तो and I have got 1% from Delhi.
I have got the 1% problem from Delhi.
Why now she has 16 stents.
Now she is having 16 stent. This person from the female from Delhi, she cannot. When she came to us, she was not able to walk, but now she is absolutely fine. 5 or 6 years ago, there was a conference in Shantivan, Ayurveda Ayush conference. In that, the patient was there. The patient had 22 stent since 9 years.
तो वो चाहते हैं कि हम अभी भी वो की हालत अच्छी नहीं है तो they want to come for the
But the person, his condition was not good. They want to come for healthcare program.
करना अच्छी बात है
Angioplasty is okay. Time being it's okay, good. But in chronic angina patient, it is not required, recommended.
काफ़ी सारे पेशेंट आप
There are many patients. We have lot of history for the patient.
एक घंटा उसी में देख जाए
I'll show you. Then 1 hour will be passed in it.
more than 11,000 angiograms.
More than 11,000 angioplasty has been done.
So whatever we are doing angioplasty bypass or
Whatever we are doing in angioplasty, bypass, whatever we are doing, it is on palliative. It is not the root cause. Genetic factors,
stress, diet,
mental stress, diet, exercise,
wrong sleep,
tobacco use,
other risk factors, conventional risk factors, hypertension,
hypertension, diabetes. There are other dyslipidemia.
These factors are responsible.
So these factors are responsible in this case.
Which we are doing is does not address the root cause.
So the modern medicine does not enter into the root cause. Our treatment is only outer dimensional. CAD is psychosomatic lifestyle disease. There's pandemic of heart disease. This is number, and is not a different. Number of persons suffering from CAD is more in India rather than abroad.
Million heart attacks every year.
7 to 8 millions every year heart attack.
Interventions per year.
So we have very less number of interventions per se. We cannot afford number of so much interventions in every year. If even if we spend crore rupees, still we are not able. There is another patient who is from US. We have a lot of patients from all over the world.
Interventions,
Various intervention trials have shown, courage trials,
trial, March 2 trial, they have
master
shown
trial.
that the interventions
These intervention in angioplasty and bypass do not address the root cause in a stable patient. So this is not the basically treatment of choice. It can be looked after without any interventions. So when you change the lifestyle,
it not only prevents or reverses heart disease, but
it not only prevent the or reverse the heart disease but everything. So I have observed this last 26 years, and this program is going on more than 26 years, the CAD program.
look into the figures in US.
So
Just I want to like to show you that this one prize, Nobel Prize in 2009 for KG.
so they have shown
अगर हम meditation करें,
if we do meditation, we'll take proper diet.
especially अपनी biology
Lifestyle changes means if when you follow your biology,
change gene expression,
we can change
3 months.
this in within 3 months.
Genes with the CAD,
Genes can be
cancer, obesity,
genes, cancer, hyper disease.
can be down regulated or turned off.
So it can be
Happy
turned
genes,
off.
effective
So
genes.
we can reoccur happy genes. We can turn it on by doing meditation, happy genes by proper diet,
Following your lifestyle.
and by following the healthy lifestyle, especially our biological clock.
Just sharing with you the results of this program.
So I was sharing the result of this trial which we have done over the years. We have three-dimensional healthcare.
Aspects of human
So it affects the 3D. 3 means spiritual care, mental. 3D means like mental, spiritual, and health.
we are doing is doing meditate. It's a meditative lifestyle.
So RAJYOGA meditation means whatever we are doing, it is a meditative lifestyle. It is not morning, evening. It is a consciousness of your from body consciousness to soul consciousness,
Gives you healthy heart,
and it gives you healthy heart, happy mind, and healthy body.
looks after each and every cellular body.
It looks after almost each and every disease of our body.
As I shared with you, in collaboration with DRDO,
So in collaboration with DRDO, we have shared this disease, sponsored by Family and Healthcare.
and this is I just mentioned how we went about this study. This study was published in 2011
And the project on you're showing this study was
by the
done,
Biomed Lab.
informed by Biomed Lab in US, which is official body. They told us
13 that your study
that your study
over last almost 1.5 years
over last 1.5 year has been more visited
doctors,
by doctors, most researchers, and published.
top 20 studies in the world.
So this is out of top 20 studies in out of the world.
Every 3 months,
They kept informing me every 3 months. It continued being number one, the studies which I have been conducted. So this is the largest seen visited study in the world.
the few studies
In those few studies, which for more than 2 years the studies
was
run.
documented by
And this study was documented by
American Heart Association
American Heart Association scientific statement
meditation and cardiovascular
on meditation and cardio induction. They mentioned this study.
technique of RAJYOGA
This technique of RAJYOGA meditative lifestyle is useful technique
for reversing
for reversing heart disease
care of its receptors.
and taking care of its respective disease, comorbidities, hypertension, diabetic, etc.
We have to go have a bigger study.
So we have to go through a bigger study.
18 patients.
So the study was done on 518 patients. Since then we have continued. Now we have more than 11,000 patients.
So 26 years the study has completed.
26 years of CAD research project has been completed in Feb 2024. Few days ago we have
Health sciences banega.
so we have inauguration of Super Speciality Hospital Global Institute of Heart Health and Life Sciences. We are constructing that, and where we will keep other than heart patient,
Reversal program.
We have started diabetic rehearsal program, diabetic rehearsal, fatty liver reversal program, hypertension metabolic syndrome reversal program. So
future we plan to
in future
biology lab,
we are going to have biology lab,
autoimmune diseases and also
autoimmune disease lab,
other diseases.
inflammatory bowel disease programs also.
I think just to recapitulate for you, mind-body relationship.
So I just want to share mind body relationship. Mind had four aspects.
Not physical, it's a non-physical thing.
Mind is not a physical thing. So we have a thing: thoughts, emotion, attitude, and memories.
And if you have negative team,
If we have negative theme,
negative emotion and thought
each negative emotion and thought or attitude
gets converted into chemical.
gets converted into chemical in hypothalamus.
And
We
these neuropeptides,
neuropeptides, and these neuropeptides travel to the
cell has receptors.
neurons, and every cell receptor has neuropeptides.
Then what happens? Sympathetic overactive happens.
Then parasympathetic over, and then stress hormones come, cortisol comes in, and we have to flight to flight response occurs.
Dizziness or lack of energy.
So, and this creates lack of energy, dizziness, etc.
We have what 8 organ systems and they keep
We have 8 organ system which keeps affecting.
childhood from the infancy.
So one of the organs which get affected from mother's womb, not which is not properly developed, which has a problem.
comes on that organ.
So maximum effect comes on that organ. Someone may have a heart or and intestine or brain or liver. Different organ system gets affected with. So and that's how we develop the disease engines. How started get
Positive team,
then it's positive theme.
what happens? Then cells of the brain and body are released
This
endorphins
positive team.
and parasympathetic activity starts.
So through the positive team, parasympathetic activities start, and this creates a feeling of well-being, feeling of energy, and it reverses the disease. Whatever the particular point the disease occurred.
Just to recapitulate, our heart has got, you all know about it.
Everybody know about coronary artery disease divided in LED and its branches, and then coronary artery.
Normal artery.
So you know about normal and abnormal artery.
Elastic. The blood supply can increase by 6 times.
The
Normally we
blood supply can increase by, normally we require 50 ml blood every minute.
increase it to 1500 ml per minute.
So you can increase it to 1500 ml. With the aging
Stress and other factors.
and stress is another factor, our arteries start blocking from childhood
Harden up
onwards.
like plastic.
So arteries get harden up, and it cannot respond stress.
That leads to angina when the blockage is around
So when blockage around 70%, that time angina occurs.
tendencies that
So when we have a negative minor tendency, hurry up, anger,
child behavior.
sadness, hostile behavior, when we are not able to vent out our stress or etc.
The yarrow say
So you must have heard when you have opened your heart with your friends, you don't need to get opened by the weapons.
26 साल में देखा
So in 26 years, I have seen, this is very important, the single most important management of chronic stable angina is writing a letter to God. Before going to bed, express your mind, whatever your emotions, your feelings happening in your body, or whatever is happening in your family, around the relationship, your profession. Just express everything by writing a love letter to God.
not a logical letter but a emotional.
Not a logical but a emotional letter. Express your every emotions, and you'll see
Within a week,
your angina will disappear within a week, just by writing a letter to God.
disease will start advancing.
And
This is what we see. काफी लोगों ने तो मैं वैसे हमारा एम था 1 साल पहले 2 साल में खोलने का था.
so our aim is to open a center within 2 years, then we have kept within 6 months.
हफ्ते में डिप्रेशन.
So some people has opened their angina within a 9 week, and some has opened 30 weeks. Air Force person
निकाल दिया गया था.
and who has been fired from his area, and he was made to unfit. He belonged to a poor family, and he came to us that I want to fit because I have been shown unfit from Air Force. And I said to him, just made a effort for 3 months. Within 9 week, he reversed his angiography, and again he went to MI room, and he has been shown as fit, and I started enjoying his life. So it's a willpower, will to be well, that comes from meditation.
और ये जो मैंने एमआई बताया, एमआई कैसे होता है?
And how MI occurred? Sudden 100% blockage
जल्दी, चिंता,
because of hurriness, anger. When you suppress the emotion, there is no ventilation of your emotions. When there is no outlet, then plaque cracks.
rupture of the plaque is your stress,
Rupture of plaque is because of your stress.
sleep,
Even during the sleep,
when subconscious mind is very
when subconscious mind is very heavy, there will be a terror dreams, and it get cracks. That leads to MI.
so you can, the block does not lead to a heart attack.
This block does not lead to heart attack. It clocks that reaches
Heart
to
attacks, events, coronary events, by
even coronary events
proper meditation, proper
can be reversed by doing proper meditation, ventilation.
इसके बाद हम आप देखते हैं कि ये हमारा कैसे बचपन से ही हमारी आर्टरी ब्लॉक होना शुरू होती है।
So we can see how the coronary artery gets blocked since childhood by stunting also. So initially,
10%, now we are seeing much more,
so now we are seeing much more whatever we was told earlier.
20% stents are blocked.
So nowadays 20% stunts are getting blocked. We do bypass.
Treatment is like cutting a tree from above
It is like cutting a tree from above. Every year
to trimming the trees, right?
we are trimming the tree. So we do trimming, and then again this blockage occurs. So because this is not the root cause of bypass doing angioplasty, or so like many patient has gone through the bypass surgery but still not able to work. So I'm not against angioplasty or bypass. I do recommend it.
बाकी जहाँ तक है अगर stable
But if it is stable angina, so we can manage through this RAJYOGA lifestyle, meditative lifestyle.
रिसर्च प्रोजेक्ट इसके साथ सभी लोग कार्डियोलॉजिस्ट भी रहे।
In this program, there were endocrinologist, cardiologist, physician, physiologist, nutritionist, fitness expert, spiritualist, psychologist.
सबने मिलकर ये program
We together made this program.
was one of the coordinator
Dr. Kalam was one of the coordinator in this study.
किस चीज़ को
So he intentionally observed every study, and personally he visited to 5 times to meet the patients, and he met to every patient, spoken to, and then Abu Healthy Heart trial we published, and
दोनों में रिजल्ट सभी पैरामीटर सेम,
we have seen the both parameters are same.
कंसर्न लेते हैं,
We take the consent from the patient, and psychologically assessment done, parameters we have taken.
7 दिन का हाउस प्रोग्राम,
So for 7 days in-house program we conducted. So we have said that every patient has to come with their spouse.
हस्बैंड पेशेंट है तो वाइफ के साथ,
So if the patient is husband, wife has to come. If a patient is wife, then husband has to come. So you have to come with the root cause.
रूट कॉज को साथ में लाना है।
You have to come with the root cause.
कॉज को ठीक करेंगे
Until and unless root cause is getting cured, disease cannot be cured. So we have said that patient has to come with their spouse, because both of them together create a disease. So this is the concept of our program. This is the important concept.
कुछ लोग अनमैरिड होते हैं,
Some people are unmarried. For them it is different.
बाकी तो अदरवाइज
Otherwise we call,
डाइवोर्स भी होता है।
even though if someone is divorcee, we call their spouse.
मैं फ़ोन करता हूँ बच्चे में
I do call them.
कि ऐसा हुआ है,
So I do call that your husband has been suffered with this, you have to come. And sometimes I have seen that 7 days they live together and they got married again,
जीवन को समझ जाते हैं,
because they understand this life.
हाथी की वजह से जीवन साथी बन जाते हैं।
Like to become the elephant of life, they become the companion of life.
करना सीख जाते हैं, फिर जीवन
Once they start living together, they become the life partner, they become good friends when they understand the life in this program, in this 7 days in-house program. So medication was same, diet schedule was same,
exercise schedule
only difference was meditation.
इंटरवेंशनल ग्रुप था उसको राजयोग मेडिटेशन दिया स्ट्रक्चर्ड
So when there was a group, we have given RAJYOGA meditation structured way.
प्रेयर करते प्रार्थना करते तो
So we have said them whether you are doing prayer or you are a Christian or you are Mohammedan, whatever prayer you belong to your religion you do. So you just remember that you should not get into anger, you should not get into hurry. We have to vent out our feeling emotions. So we have done their EEG also. We have checked their endorphin, cortisols, melatonin, dopamine level, saliva test also.
कॉर्टिसोल लेवल थी क्या
So through the urine level, with DRDO we have done lot of research. Serotonin, endorphin levels we have checked through. So we have studies all those things, and
एक साल में
within a year we did angiography.
20% सिंगल वेसल डिजीज
So 20% was single vessel disease.
डीआरडी को भी उन्होंने किया आईसीएमआर
Some people has been gone through ICMR. So independent studies also we have gone through. So this parameters have been gone through different people. So we have studied psychology parameter also.
जो भी हमने अलग अलग लोग थे अलग डीआरडी
So we have different people from DRDO. We have collaborated with them, and together we have gone through these studies so that it can be non-biased
एक टीम बनाई
interpretation. We have made a team of CSI.
इंडिपेंडेंट पैनल
See, he was also independent panel. He also have seen angiography. In the study result,
100 मीटर चलने
those people had a problem of 100 meter walking. So their number of tablets medication has been reduced.
500% से ज़्यादा बढ़ गई इंजेक्शन पैटर्न ओवरऑल इंजेक्शन
So overall ejection fraction heart has been average 10% increased.
प्रोफाइल भी गुड
So lipid profile, in lipid profile good cholesterol has been increased significantly. Their triglyceride also gets reduced. So overall issue parameters which were affecting the body get reduced.
लगभग 464 लीजन्स हमारे पास थे
We have 464 reason.
हमने 100% कैल्सीफाइड ब्लॉकेजेस नहीं लिया था
We have taken
कैल्सीफाइड ब्लॉकेजेस थे
100%.
हमने उनको इसलिए लिया था बिकॉज वी थॉट
We have not taken 100% calcified blockages, but so we had a thing that is not going to open. 50% blockages we have tried out of 50. 29 CTOs gets opened.
समझे आप कैल्सीफाइड ब्लॉकेजेस
Calcified blockages 100% also gets opened.
तो कैसे हुआ हमें भी बड़ा आश्चर्य था कि कैसे खुले
This was surprise for us also. So first angiography done.
दयाल संधान
The patient Deen Dayal, and he said that doctor, we have a repeat angiography is going to done. Please do meditate for us. So I had a feeling that I was fear also. So we have two types of mind: a spiritual mind and we have a logical mind, which related with science. So this feeling had that how can this blockage can be opened, because it had a 90% blockage in that patient. 12:30, Dr. Ashok has from Jaipur called me. So I did angiogram 2 years ago. This patient.
इतना दिखाई नहीं दे रहा
So I'm not able to see this blockage. 20-30% only blockage is there.
आपको कहाँ गया मुझे नहीं पता
So I said that you can check, you can see where this block.
इतना अच्छा ब्लॉक उसका नहीं है।
So this worked so better. Further angioplasty angiogram has been gone through, and the blockage gets opened. So one formula I understood: if you 50% you follow it, there is no. If you have followed 50% at least,
तो आपने 40% 60 किया 40 नहीं किया तो लगभग 20% ओपनिंग हुई
so 60% if you follow, 40% not done, there will be 20% opening. If you done 70% following, तो 40% opening. If you followed 80%, so there will be opening. Depending upon how you follow this Rajayoga meditation lifestyle. Rajayoga is not meditation. This is a Rajyoga meditative lifestyle. Your diet will get changed, your sleep get changed, your exercise you have. So this is throughout the day 24 into 7. This is your meditative lifestyle. When you are going to sleep, with your every breath, you have a practice of soul consciousness.
shining star,
I'm a shining star.
body function.
I make the body this function.
Mom Sharira.
I, the soul, this is my body.
I make this
I am the soul with this human body. I make this body to function. So we have worked on this mechanism and this has changed completely.
some of the angiograms I'll show. Light of
Some angiogrammy I would like to show. You can see the screen.
you can see.
You can see the screen.
There's 80% block in
So there is 80% blockage,
2 years.
and after 2 years,
Significantly blocked will be.
so significantly lots of blockage gets opened. You can see in the screen.
देखिए ये 100%
In one case, you can see the 100% blockage. This is not operable disease.
यहाँ का पूरा पूरा इतना almost more than 4 centimeter लंबा block.
More than 4 centimeters blockage.
Angiogram में कितना significant
In repeat angiography, this get opened. Significant change.
calcified block है.
There is 100% calcified blockage.
Calcified block है और repeat angiogram में
In repeat angiogram, this get opened.
इसकी 100% block है.
Another patient, this at 100% blockage, it gets opened. Multiple blockage also gets opened. 80%, 90% blockage gets opened.
किसी patient को heart attack MI हुआ था.
This patient had MI
फिर infection वाला MI हुआ, injection 30% रह गई थी.
and it had in repeat angiogram you can see 45%
Significantly मतलब उसकी region
done.
को bypass है.
So significant region has changed.
80% patient.
So patient had 80%, Chote Lal patient named as from Rohtak. This patient had 80% blockage, and then later on you can see angiogram blockage gets open.
हमारे पास जब आया 1 साल बाद
So post MI 1 year ago, repeat angiography 50% blockage, and later on gets opened.
100% calcified block था.
This patient had 100% calcified blockage, but it gets open. In control room,
क्या देखा कोई भी
control group blockage has increased. So whoever do the intervention, any disease, alternate medication they do. So whether you can have anything, take any healthy diet, whatever pranayam, asanas you can follow. There is nothing which can open your blockage.
होता ना आज ECP करते हैं उससे block.
So ACP also,
Thought pattern music.
this is the thought pattern which opens your blockage.
6 पे करते हैं 7 पे करते हैं.
Because we do it so we do repeat angiogram at a time span. So due to psychology there thoughts parameter gets changed and blockages get open. So every block is connected with thought patterns. So with Rajoga meditation, as you changes your thought pattern, your blockages gets open, and whatever thought patterns you do not change, your blockages gets created. So when we see the angiogram patient report, so every month I get the 100 to more 100 reports. Through the angiogram I get to know the thought pattern of patient. So I get the imagination of the people by seeing the angiogram how this person would be. Sometime in group we can identify so this person is walk through this way. So the patient wonder that how get to know my name, but through the angiogram I get to know about, I can identify the patient. This is person could be this way by their behavior, by their walking, because of thought patterns. This is the first time.
ऐसा कुछ thought pattern से क्योंकि हमारा database है.
So you can, so we have a database of 11,000 patients because we have 11,000 patients angiogram we have.
Nothing can open the blockage.
Nothing can open your blockage until unless you can change your thought pattern.
दिल में क्या चल रहा है.
So we have a physical heart, but we have a heart in our mind. So
और ये repeat एक और angiogram आपको दिखाता हूँ.
one more angiogram I would like to show you. This person has 100% calcified blockage. Sister Rajni, 45 years from Ahmedabad. Calcified blockage is there. In repeat angiography, see blockages gets opened.
देख पा रहे हैं.
Are you able to see that?
तो ये मैं छोड़ देता हूँ. तो साइकोलॉजिकल पैरामीटर जितने भी थे टाइप ए बिहेवियर
So whatever psychological parameter, type A behavior, anxiety, depression, anger, we usually have a questionnaire where we check sensitive nature, everything.
पैरामीटर सिग्निफिकेंटली चेंज हुए
So these all these parameter changes significantly.
मतलब देयर इज नो सॉर्ट ऑफ पी वैल्यूज आप मेजर नहीं कर सकते
So
ऐसे ही उनका जो पेशेंट कुड स्टॉप स्मोकिंग अल्कोहल एवरीथिंग
all patient also stop smoking, alcohol, etc.
दिखा तो ईजी दिखाता हूँ पेशेंट से
So I want to show you the EG of patient.
नाइस अल्फा रिदम व्हेन यू क्लोज योर आईज पीसफुल रिदम
So you can see the the peaceful rhythm, alpha rhythm, and
अल्फा रिदम इज लवफुल एंड सॉरी हैप्पी एंड पीसफुल
so delta rhythm is when we are in deep sleep.
एक हफ्ते पहले की देख लीजिए आप और एक हफ्ते बाद
1 week before, you can see the EEG, and after 1 week the EEG has taken. So we do meditation with opened eyes.
पहले पहले अल्फा रिदम बीटा रिदम कम हो गई
See, the alpha rhythm reduced.
एक्सेप्टिंग पीपल एज दे आर
Love means accepting people as they are unconditioned.
स्टॉप टू द पास्ट
Peace means putting a full stop in the past and being in the present. That is peace.
accepting people are as they are in your family
Love means accepting people as they are wherever your family is there,
happiness is contentment
and happiness is contentment.
and bliss is going beyond
Bliss is going beyond this godly, beyond this world, going to the worldly, godly world, to where supreme soul resides.
ये आपकी स्टेज whatever you're doing
Whatever you are doing, you get this stage just in a week if you practice sincerely. This is done by DRDO, not by me. With open eyes, you get the better result. You're doing everything.
देखिए इसमें देखिए अल्फा
So you can see the screen. So alpha rhythm
सिग्निफिकेंटली एक हफ्ते
gets changes, theta rhythm increase. So within a week, and that keeps on increasing. So we have done sympathetic and parasympathetic activities.
लो फ्रीक्वेंसी पावर represents
Low frequency power represent sympathetic activity. When these people came to us,
came to us they were
sympathetic dominant. When these people came to us, they were flight and flight mode.
activity was much less relaxation
So parasympathetic to flight was very much, activity was much less. Within practicing this program,
came down
their sympathetic activity came down, parasympathetic activity increased, and they were in better balance to handle the stress.
coming you cannot be
Challenges keep upon coming. You can't without be challenged. Challenges would be there, but when you face the challenge with the relaxed mind, how to face the challenges with relaxed mind, that is this Rajoga meditation teach you. So, and this is how we reverse the diabetes, hypertension. So they reduce their extra kilos also.
psoriasis
They could reverse the psoriasis, GRD, prostatic cancer also, reduce the asthma.
and then continue 2 years further
It continues for 2 years. Furthermore, harmony. The more you practice this meditative lifestyle, Rajoga meditative lifestyle, you become a balanced person. Similarly, the stress hormones.
epinephrine levels adrenaline levels
So adrenaline level also within a week there is significant change. Within a 6 weeks, a significant change occurred.
serotonin and endorphin level
Similarly, serotonin, endorphin level control group has not changed, but the Rajoga meditative lifestyle people who were in this, they have changed. A significant change occurred. So you don't feel the pain; you feel very light.
8 a.m. 8 a.m. 8 a.m. and 4 p.m.
We did 8 a.m. 4 p.m.
in the blood and urine
cortisols
at that point of time and
check.
urine over 24 hours.
So blood and urine checkup within 24 hours. So whatever. So what we saw within a week by practicing this meditation, what we teach is
This is the physiology.
this is the physiology that after getting
After half an hour,
after half an hour,
your adrenal gland starts creating cortisol.
so your adrenal gland start secreting cortisols. So what type of team you have, what of thought, attitude, emotion, memory you have. So up to 8 a.m.
See what happened 5
cortisol increases.
5 a.m. to 8 a.m.
From 5 a.m. to 8 a.m., whatever team you would have, you create that kind of cortisols, and that will decide your day from 5 a.m. to 8 a.m. So if you have negative team, so that it will create cortisols would be, so it would come, it would get secreted in a higher amount. So you would be in hurry, you would be hurry, in aggression, irritation,
your efficiency will go down.
and your efficiency will also go down.
On the other hand,
On the other hand, if you practice meditation, Rajoga meditation, 4 a.m., and immediately
meditation will trigger
meditation will create your positive team, and that harmonize your pituitary gland, and cortisol secretion will start immediately,
you will have positive team.
and it will create a positive team.
It's
So,
nothing but godly versions.
so Murli is godly versions. When you start churning those point godly versions, and it create positive team, 7 to 8 Murlis, and when we listen to that Murli, so there would be maximum cortisols of positive team,
Again 4 p.m. there is again release of cortisol.
and there will be again 4 p.m. would be a 2 to 4 p.m. you would be relaxed, easy, relax. So have positive team. Just be careful. Just don't entertain negative. So 4 to 8.
And efficient.
So in morning again you will be at efficient, and you will have good sleep.
This is what we teach our patients.
So we used to teach our patient how can manage your time within a week within that program.
The significant improvement.
So you can see on a screen there's how significantly the changes comes. So and your life become much more vigorous. Similarly, insulin level,
So secretion of more.
as cortisol level increases,
So it should decreasing cortisols
which by doing meditation cortisols gets decreases.
from the liver. And
Cortisols,
insulin is released from the pancreatic cells, beta cells.
as insulin gets
This is continuous. So
in
glycogen is coming out.
gets secretes from pancreas, and
You feel more hungry.
so as glucose creates insulin increases, you feel more hungry.
Dyslipidemia, obesity.
So this everything chemical reaction are are very connected with each other, and disease, how the disease comes in. So here
On insulin, 60
patient on insulin 60 units, 80 units,
within a week.
they have stopped insulin within a week, and diabetes gets under control.
Sugar of 350, 400.
Patient came with blood sugar of 350, 400. So third or fourth day, their 60 unit of insulin reduced,
They never experience
so which they never experienced, and that decreased the unit.
their off insulin.
And after 6 weeks, they after 6 days they comes on without insulin. So number of patient had lot of, so insulin sensitivity also has improved, and it decreases their weights, and their triglyceride also gets okay. So I had also 28
692
in 1996. I had 692. Now we have below 80.
अब इसका कॉन्सेप्ट क्या है? मैं 5 मिनट बता
What
दूं
is the concept of this?
कैसे इंसान को मरने के बाद क्या कहते हैं बॉडी को लेके जाए.
So after dying, when a patient comes in accident, so when they can not save, they said that I'm sorry, we have tried our best, take the patient.
नो ऑर्गेनाइज फंक्शनिंग.
No organized function.
पहले अगर मैं किसी को कोई पेशेंट और है जिसको डायरेक्ट कार्डियोपैथी है, ये इंजेक्शन पेशेंट ओनली 10%.
The person has need a cardiac transplant.
Tissue matching. You can take out the heart from here. and
We
pass it.
can, if person knows before.
What makes the organ function?
So what makes organ function? So it is soul which makes the organ function.
ये मैं छोड़ देता हूँ. Human being is a continuous spiritual, mental, physical energy, not only physical energy.
So human being contains metaphysical and spiritual energy.
Health is nothing but dynamic process of.
So health is nothing dynamic process of all three.
एक बहुत सुंदर बात जो समझनी. Only
A
soul
beautiful
of
thing.
memory cells in the brain.
Only soul of few memory cells are continuous with our life.
More than 98,
Rest more than 98% of cells are changing every 3 months to 2 years.
आपकी पूरी एंडोथेलियम बदल रही है heart की.
So endothelium is completely getting changed within a period of 3 months.
आपकी
So
GI tract बदल रही है.
your GI tract is getting changed, your heart is getting changed within 2 years,
Depending on your team.
depending upon your team.
टीम पॉजिटिव कर रही है.
When you positive your team, I'm a being. When you become soul conscious and you made your team positive for 3 months, So new endothelium which is going to build up, there will not be any blockage, there will be maximum 10%. If your fatty liver is going to okay.
एक ग्राम लीवर पैंक्रियाज में फैट जमा होता है ना,
If in pancreas 1 gram fat is getting deposited, uh, so there is 12 lakh beta cells, there is weigh around 1 gram, 1 gram fat get into liver, that you get into diabetes. So when you take out the fat outside, your diabetes get reversed.
13 से सीधा 6 आ गया.
So it'll come from 13 to 6 or 5 5 and a half.
तो आप चाहे तो कुछ भी कर सकते हैं.
You, if you want, then you can do anything. This is the power of your mind, that is your willpower. One more thing,
Made up of 80,000 billion cells.
your body is made of 80,000 billion cells, and in every cell there is
Cell there's 100,000 reactions in
100,000 reactions,
free radicals भी बनते हैं.
and there would be free radicals also. They can also washed out in a second, because our heart beats every seconds.
एक बार सेकंड में बीट करता है 70 मिनट.
70 minutes,
किंतु जब आप
70 per minutes. So when you are type A behavior, so there would be reaction of 1 lakh 1,20,000 more than. So extra toxins does not get cleaned, and it gets deposited into blood. So when you get irritated or get into worry, so there would be more than 2 lakhs reactions. Some get sadness and their reactions get increased. That is how our cells become ill. When they are not able to make proper insulins, proper hormones, enzymes, and that we have developed a disease in those cells. So because your cells are not producing that hormones, chemical enzymes in that way, and we creates disease. On the other term, meditation. So ABCD, Atma, APCC, Atma, Paramatma, and drama, connection and drama. So when we gets connected to Supreme Soul, our battery gets charged. So those who are together around us, people are working with us, they are like to going to discharge our battery. So they are going to finish at the battery. So but our battery only gets charged with the supreme power, supreme soul. Adadi Prakashmadi would say, what is the definition of in charge? Adadi Prakashmadi, she used to say, Gupta ji, tell me, what is the definition of in charge? So she used to ask me in modeling, what is called in charge? So I said, who is the head of department? That is called as in charge.
जो इन रह के अपने आप को चार्ज कर.
So she said, no, in charge means those who can live in and can charge yourself with this powerhouse,
अर्थात सत्य की समझ.
with the power of knowledge, true love, the one who connect yourself with the supreme soul and fill their mind, body, mind, intellect, and sanskar, nourish with that supreme power's energy, and it nourishes your heart, immune system, everything. Those who stay together with their family, their relatives, so though the person who can nourishes all the families and relatives around us. So those who gets angry, show eyes, they like outcharge. Those who want to become in charge, raise your hand. So we have to become in charge.
शांति आती है ना.
So
Stop to the past.
when you put a full stop to the past, being in the present, so there will be a peace.
Every second you are.
So every second you are washing out free radicals.
That is how you say peace heals.
That is a peace heals. Love means accepting the people as they are without any condition. You start accepting the things as they are. So every second you are getting rid of 40 more than thousands of free radicals. And that is, they said, true love heals. Happiness means contentment. So in happiness there will be 40,000 reactions, and there will be 60,000 free radicals wash out. So this bliss also wash out all the toxins. That is why it is said that bliss heals,
That is how you heal the body.
and that's how you heal your body. This is the next paradigm for modern medicine.
Concept that what simple principle. Stress means pressures divided by coping ability.
Uh, Stress means pressure divided by coping abilities. And when there would be pressure, there can be internal, external pressure. The only method to prevent from this is meditation. What is meditation? Connection with the truth. So, what is truth? Which is eternal and which is unchangeable. What is truth of human beings? Human plus being. Human means this body, being means life force, outer self and inner self. So when outer self, you are body conscious, unstable, you are insecure, there would be jealousy. With the insecurity, there would be five vices would be because of anyone's intellect or physical being, you get attracted. So anger means like the one who comes in our comfort zone, we get angry on them. So attachment, what is attachment? So who are in my connection, they should be with me. So ego means whatever we have gathered, we get attached towards that things. So this is called the stress, the all the five vices, and this is why. So we will have a bitterness in my mind, like in we used to have a sweet. So there will be dryness in my mind, and we want a hot and spicy food. Even though we would have a blood pressure or diabetes, etc. People said that okay, if I have to diet, then we will have everything. So even doctors usually have more prone to disease because of they do not practice how to reduce their stress. And this person they late to bed, late to rise, and this person that such kind of person do not want to exercise, and this person get into prone to disease. Instead of this, when you get into soul conscious, you get the seven energies of soul. When you filled with seven energies, you will have values, and you will become stress free and proper food. So mood and food, this affect. So one person live for the food, and the one person take the food for living. So this person would be. So I say this is self responsibility, self awareness. So the one person can heal you, which is you are. Doctors can you guide, parents can you guide you, doctors can you guide, but God can help you. So healthy means soul conscious. So this mind is our subtle body, and this seven energy of our mind through our team, it meets to body, and every cells is very required and which heals. So at 4 a.m. when you wake up and when you consider yourself as a soul and remember supreme soul, yeah, you're positive, you would have a positive team. So 7 to 8 when you listen morely, then your positive team occurs. And when you have proper positive sattvic food, you take medication on time, so there would be shield around the body, which we call it aura, and it protects you. This is our concept. So about 50 to 60 patients we call in a group, and when he treats them. In this way people come, and 7 days we live together, we do program, and they get healed within 7 days program. So we have this program conducted in schools also. So we have told about the reversal of all the disease comorbidities. So we have done it more than 1,000 groups, more than 1,000 angiography. Takeaway messages: first, spiritual care, whatever you are doing, by being a soul conscious. For this, wake up early in the morning, 4 a.m., experience the state of bliss. So your pituitary gland will harmonize. Till 8 a.m. you should be in silence, listen godly versions. So, and for body, have fruits, vegetables, sprouts, and exercise. Have light food, proper cooked food also, raw food also, but you should have a balanced diet. So in evening before 7, before sunset, you should have your and 10 a.m. just have a sleep and wake up early in the morning. If you think that angioplasty is necessary, you can go through. This is ultimate, but angioplasty is not ultimate treatment, but the changing of lifestyle is important. So I would like to call a patient who is named as Dilwala. So patient Naresh Bhandari, he was a heart patient. He's so we would like to invite Dr. Ashok Mehta. He is our chairperson. Om Shanti. I am a soul. The body name is Naresh Bhandari. I'm from Bombay. My age is 74 years. So I'm Deputy General Manager in India's big consulting company. 2007, when I was sitting in my office, so I've gone for a test, and there, so I have been gone through a 2D echo test, where doctor has said, and doctor said that there is only 27% pumping, and he said let's go up above and we will go through angioplasty. So I said that I'll go to Bombay and I will take second opinion. So when I came to Bombay, so I went to Surat Mahavir Hospital also. I have gone through angioplasty, and in LED 90%, ICX in ICX 80%, in RCM is 70%, and in OM there was 100% blockage. Doctor said you should go through immediately bypass surgery. I said I know doctor in Abu. I'll go to him and get treated there, Dr. Satish Gupta. So I contacted Dr. Satish Gupta, but I couldn't find him. But I get to know that he is going to come to Bombay with Dadi Prakashmani, and he is in his heart treatment. And I directly went to him. I showed him a report, and he said for 2 hours you have to come to hospital and how to open your blockage. And for 45 days continuously, I and my wife came to Dr. Gupta, and one-to-one got the teachings and what are the exercise, what diet we should take, everything. He guided us so well, and I followed that. 2010, when I met to him in trauma hospital, doctor said, and he said that go for angiography. If I go for angiography, the doctors will not leave me. I have to go for a surgery. So he said that I'm giving you a doctor who would not admit you. He'll just do CT angio only. I went to doctor. He did CT angiography, and for 10 minutes he was looking at my both reports, previous reports, and he said that so 100% blockages has gone away. And there were only in RCM only 5% blockage was there. OM was 100% block, but everything blockages gets opened. And he said that there's no difficulty, much difficulty in your heart. And when I came to him in 2011, he has get done 2D echo test. And that time it was like heart work functions more than 67%. And since that he offered me patient service. So since then I do serve with Dr. Gupta. There is another brother, Jagdish Patel Bhai. He is industrialist. He came to us in 2010. He is having diabetes in 35 years. He was 40 units of insulin
में था, L6 में था, RC में था, and because of diabetes बहुत ज़्यादा थी,
because he had very much diabetes, so he couldn't get operated.
वहाँ हमारे प्रोग्राम में आए,
So he came to our program,
102 ग्राम, 102 किलो था,
and his weight was 102,
हाई हो गया था,
and within 3 months he had 85 weight. Sugar insulin get stopped.
55% हो गया था और इनका वजन 85 किलो हो गया था। तो तब से फिर उस प्रोग्राम से लेकर 99 प्रोग्राम तक हो गए, तब से हर
So from that program in 99 till 99 program we have completed, and since then he is in food service. He is 52 and
वहाँ पे 1970 स्टेप्स हैं,
so in Ambaji 190 steps, he within 15 minutes he has been completed that step. Yes,
150
he climbed that ladder
एंजियोग्राफी, रिपीट एंजियोग्राम ब्लॉक खुल गए,
and repeat angiogram, and his blocks get opened, and so happy you can see. Thank you,